Everybody, welcome. The titles never mixed up, never correct. So today's session is all about, can diet help with adenomyosis? And our team dietitian Kaylee will be joining us shortly, I'm sure, but I will let you all come in and say hi. Oh, there she is, so quick. So good to see some of you joining us live. If you're watching the replay as well, let us know. I'm hitting accept. Okay.
Hello.
Morning. How are you?
Good. How are you?
Good. I've got the title edit situation's not working for me. So anyway.
Why can't the titles change? I don't understand.
No, neither do I. And Instagram has removed my ability to go back and find them and edit them. So it's just like, what will we get today?
Well, I come for one thing, you get another. I guess it's exciting.
I'm sorry, everyone. It's not clickbait. It's just, it is what it is. Well, welcome back, Kaylee. Today we're going to be talking about diet and adenomyosis. So before we dive into it, a lot of people have never even heard of what adenomyosis is. So perhaps we can start there. What is adenomyosis? Who does it affect? How many people could potentially have adeno? And then we'll get into nutrition.
Yeah. So I guess it's a little bit different to endometriosis, and they sound very similar. But adenomyosis is where the endometrial tissue actually grows into the middle layer or into the muscle of the uterus. So that's different to endometriosis, where you can actually find endometrial-like cells, which actually don't necessarily grow on the uterus, but they can also grow other places, a lot of the time on the bowel or bladder. Yeah. So not necessarily in the reproductive system. And I guess adenomyosis, a lot of people think that it only affects older women, so women that are not in their childbearing years anymore, but that's not necessarily the case at all. And we're finding a lot more younger women, so women of childbearing age, 18 to 45-ish, with adenomyosis. So yeah, I guess with more research and better understanding, we will get better diagnosis. But it's, I guess, in saying that, it's not necessarily a condition that only affects women over the ages of 45. And we think that it affects around about 20% of women worldwide. So that's a lot of people that this affects, which is scary.
Yeah, absolutely. I know those new statistics came out of Endometriosis Australia, I think just last week, of 1 in 7 Australian women who got tested in their 40s were coming back with endometriosis, and it's probably undeniable that they probably had endometriosis for a long time. But adenomyosis, we're not as clear on the statistics, and I've read so many different studies, but in any gynecology clinic, that there can be up to 20% of patients who would qualify for a diagnosis of adenomyosis. So a lot of people with endometriosis also have adenomyosis, but a lot of people just have adenomyosis. And on our endometriosis account, endo.dietitian, I get so many DMs from people being like, can this stuff help with adeno, or is there like a completely different approach? Like, what's the nutrition, like, kind of recommendations for adenomyosis? So can you step us through, I guess, can nutrition help? What role does it have to play? And then we can talk a little bit about some of the key principles.
Yeah, so nutrition can definitely help. And I guess even though adenomyosis and endometriosis are not the same thing, the principles from a nutrition perspective are quite similar, because they're both an inflammatory condition. So we have more inflammation in our body, and they're also, I guess, estrogen linked. So because of those two similar components of the conditions, a lot of the nutrition principles are very similar, and nutrition can really help with some of the symptoms of adenos. So things like pain, so a lot of that kind of pelvic pain. Also, again, that inflammation, we can get bowel issues. So again, symptoms very, very similar, and it's sometimes hard to know, especially if you have both, where are my symptoms coming from? Are they coming from both? Are they coming from one, the other? I don't know. So yeah, nutrition can really help with the inflammation perspective, but then also with the estrogen.
Yeah, I always call adenomyosis the ugly stepsister because she is ugly in her symptoms and the way that it affects a lot of people. It often isn't getting as much attention, and it's because really, technically speaking, adenomyosis can't fit. Like in theory, you can diagnose adenomyosis based on symptoms. If you've got a hysteroscopy or you've done a laparoscopy and had a look, a lot of really good surgeons can identify the adenomyosis just by looking at it, or as well, some MRIs can pick it up. But in the gold standard is actually to have a hysterectomy and then to pathology test the uterine tissue for adenomyosis, but then you've had a hysterectomy. So for a lot of people, that ends up being sometimes an option that they consider from a medical standpoint to manage adenomyosis. But there's a lot of people who, haven't had kids yet or want to have children or just don't want to have a hysterectomy for whatever reason. So, which is understandable. So that is a really important distinction as well between the diagnosis, and we can't really cut out adenomyosis like we can cut out endometriosis, although it does grow back, but we just don't get that opportunity with adeno, which makes it that much more kind of chronic. And I think the other thing to know on a nutrition front is how common very heavy menstrual bleeding is with adenomyosis, that the risk of things like iron deficiency are very, very high. So I think that's another important component too. So maybe let's talk about your top 3 nutrition tips for adenomyosis, so that anyone who's listening who's got adeno or knows someone who does or might think that they do has some little tidbits that they can get to work on.
Yeah, so I guess my top nutrition tips really come from a inflammation perspective.
Yeah.
So, and again, if you've listened to a lot of our talks or us chatting about endometriosis or seen our endometriosis tips, and if you follow Endodietitian, obviously you would have seen some of these tips. So really, antioxidants. Antioxidants are a huge part of our diet, and they really should be. And that's really important to get a variety of different antioxidants. Like I know everyone's like to me, oh, I eat blueberries. And it's like, good for you, but that's not the only antioxidants we have.
I have acai bowls on the weekend.
Yeah.
That's my favorite one.
Exactly. Like, that's nice and they're delicious, sure, but we have some other things. So really trying to make sure, and you've possibly heard this before, but eat the rainbow. It's so important to try and make sure you're getting a variety of different colored fruit and veggies into your diet. And as well, I find that encouraging yourself to eat more colors will then encourage you to eat more vegetables as well. And I know sometimes it's like, well, I don't want to have another vegetable. I had enough. But if you encourage yourself to have more colors,
it's more fun.
More of an enjoyable way.
Yeah.
Exactly. So that's my first tip. Really try and make sure you're eating the rainbow. Try get at least 3 different colors in each of your main meals. So breakfast, lunch, and dinner, if that's the way you eat. And as well, try go for different colors throughout the week as well. So not only greens. I know we have a huge thing like, oh, I should always eat my greens, but the reds, the oranges, the yellows, they're important too. And then my second point, again with the inflammation, is we really need omega-3 fatty acids. And I'm not talking from a supplement point of view, I'm really talking from a food perspective here. So if you are a fish eater, really try your best to get at least 2 servings of oily fish per week. Our oily fish are salmon, trout, mackerel, sardines, anchovies. Every time I tell clients, they're like, oh, no, I don't eat those, but really try them.
No.
Try them. You might be pleasantly surprised.
Yes.
And if you're not a fish eater, there are some plant-based sources of omega-3 as well. We've got things like chia seeds and walnuts and black soil, and also our linseeds, flax seeds. Not our plant-based omega-3s are not as anti-inflammatory as our marine sources. So if you don't eat fish, good idea to check in with us so we can give you some more tips on how to actually get some better sources of omega-3 from from food. And then my last point is really on looking after your bowels. And
yeah,
the reason I'm saying this is especially because of the estrogen. So what happens if we've got something like constipation, which again, like I said a little bit earlier, bowel problems are really common with adenomyosis and endometriosis, is that especially if you have constipation and you're not moving your bowels regularly, the estrogen can almost reactivate. And that is just going to make the situation worse. So really important to make sure we're moving our bowels regularly. If that's once a day, if that's what normal for you, if that's not normal for you, whatever that is, well, I guess whatever is normal for you is really important to make sure we're moving our bowels really as regularly as we possibly can. Will help. And especially even just help with some of the symptoms, especially if we've got like chronic pelvic pain.
yes,
Being constipated is just going to make that pain so much worse. So really important to, not fun.
Yeah,
not fun at all.
It's not a good time. Yeah.
So yeah, really, really important to get your bowels kind of under control, and that looks very different for everyone. And that's where personalized nutrition support is really important, especially for bowel health, because there really isn't any normal. I know we think like, oh, it's normal to go once a day. For some people, that isn't normal, and that's okay.
Yeah. Yep, absolutely. I think as well to like cap off what we've talked about, I think an important thing for us to acknowledge is that the research on adenomyosis and diet is essentially non-existent. There is no studies that I've seen that have looked specifically just at adenomyosis and diet. We're extrapolating a lot of this information based on the commonalities between adenomyosis and endometriosis, but they are, of course, different conditions. So it's important to kind of like give it a go, because I mean there isn't that many management strategies really available for people with adenomyosis besides, hey, cut your whole uterus out and then you'll be fine. Like that's not an option that everyone's willing to undergo, and that's completely understandable. So I think we have to acknowledge that, and in general the research in adenomyosis is extremely slim, just even the medical research. So it's just one of those like additionally underfunded, additionally like under-researched areas of female health, which is so potentially so common. And that all adds up because then there's fewer options, there's less understanding of the disease, there's less diagnosis of the disease, there's less options to consider. So like we could completely acknowledge that we don't really have that much research, but at the end of the day, we can understand the components and the commonalities of the disease and apply nutrition principles accordingly, and of course based on your symptom profile and so on. So yes, I know adenomyosis is yes, ugly stepsister, but a very quiet one in the world of diet and nutrition research. So I think that should hopefully change in the next decade or so. Do you have any final tips to leave people with, Kay, before we wrap up and get on with a big day ahead?
Yes, big day of clients. My final tips really are to get support and get support early. You don't want to be suffering for 5-6 years and in so much pain and it really impacting your life, and then be like, okay, well, I guess I'm just going to get help now. Just do it from the get-go so that you're not at the point where you're, clutching on straws. What do I do now? So really get support. That's what we're here for. We see a lot of people with adenomyosis, whether you have endometriosis as well or not, it doesn't matter. We see a lot of people, and we're here to make sure you can really live your life to the fullest, whatever that looks like, and that looks different for everyone. So please reach out if you need some nutrition support, even some quick tips. That is what we're here for.
Yeah, absolutely. A lot of people don't find out that they have adenomyosis until they face infertility or fertility concerns or are undergoing IVF as well. So we see it a lot in that context as well. So if that's you, please reach out, because there are certainly lots of things that we can aim to do to enhance the chances of implantation with adenomyosis as well. So please sing out via our DMs or head to our website, thedietologist.com.au, to send an inquiry to work with us. It is an especially busy time of the year right now. So if you're on the fence and you're not sure, definitely reach out sooner rather than later to avoid missing out on a spot before Christmas is here, because it'll be here before we know it. So thanks so much, Kay, for joining us and sharing your wisdoms. Much appreciated. I'll be saving this to our Instagram page so people can refer back to it, and have a beautiful day, everyone.
Thank you, everyone.
Bye.